Hello everyone, I'm Karen. I'm a nurse and a teacher at the University of Hertfordshire. This poster is from myself and my colleagues in simulation and the third year field tutor for nursing about a new simulation that we designed for third year nearly qualified student nurses. So a bit of background, we've got a module at the end of the third year called the Transitions to Professional Practice module. It runs alongside the final sign-off placement that the third years have, and there's a focus on getting them ready for their first post as qualified nurse. And we know that they struggle on this placement to get real experiences of being left to act autonomously, make decisions and deal with challenging situations independently. And we know that once they qualify, these situations arise quite quickly and it's extremely stressful. And we know that a lot of newly qualified staff nurses will leave their post, if not the NHS, if not nursing, within 1 to 2 years due to the stress of the transition to being left in this autonomous situation. So the simulation was designed using the session framework that we use for what we call simathons, where we try and get through hundreds of student nurses through a simulation scenario. So the last cohort was 230 student nurses, and over 3 days we divided them into groups of 25 and ran a simulation for 3 hours at a time for each group of 25. So they're on a ward, it's a 4-bedded medical ward, and there are 4 patient scenarios in the ward that they get introduced to at the beginning of the session. And then the patient storyboard, if you like, for each of those 4 patients progresses throughout the session to include some challenging scenarios. And we pick those up from the reflections from the students in this module. So situations that they've chosen to reflect on in an assignment, we gather a catalogue of those scenarios. So deteriorating patient is in there because responding to the deteriorating patient from a nurse in charge perspective is included rather than identifying the deteriorating patient through assessment. Difficult situations around patient admission, discharge, errors, challenging errors. So we have a patient that's having a blood transfusion and there's a progression of difficulties and errors around the administration of the blood transfusion that they need to be quite assertive in that encounter with that patient. We have a patient who has dementia who becomes acutely confused and tries to leave, presents quite an unsafe situation for them to respond to. And we have a patient that was due to be discharged that then deteriorates, and so there's an encounter with a bed manager who has a plan for that bed, and they're the nurse in charge. We focused on reality when we were designing and used this model here around the 3 aspects of trying to increase the reality of the scenario. So we wanted the students to be on their own, and one of the main feedbacks that we got was they said they felt like they were on their own. They had a telephone and there were people scripted at the end of the telephone, and sometimes the telephone would ring to sort of promote parts of the scenario to develop. But we wanted it to feel real. So we had our clinical ward. We used 3 simulated patients. We did use 1 mannequin with an iSimulate monitor who was the deteriorating patient. So they were just responding to the fact that patient was deteriorating and escalating. But the other 3 patients were simulated patients who they could obviously communicate with in a realistic way, and we had scripted staff as well who came in to give them that high level of realism. And again, we worked on the scenarios with colleagues from practice as well as student nurses' reflections to make sure the scenarios were highly realistic in terms of likely to happen and something that they would encounter. We didn't gather any quantitative feedback. We asked for open feedback from the students. They found that it was very realistic, was the feedback, and they found they were able to practice their communication skills. And going forward, we're looking at the feedback on the student nurses' assessment documents. So we're looking at feedback from their mentors on their final placement and starting to map trends in what we see in the feedback from their mentors. And the next steps that we have is to identify students who either aren't getting these opportunities in practice or who are struggling, and offer them to come back into the transition ward simulation to have an additional session to support that final placement.
Thank you.